In the world of aesthetics, it feels like there's always some new it treatment, right? But what if the next massive breakthrough wasn't another filler, but a way to actually get our own cells to turn back the clock? Well, today we are diving deep into something called exosome therapy.
So let me ask you this. What if your cells could literally send messages to each other? You know, giving direct instructions on how to repair damage and make things new again. It sounds like science fiction, but it turns out they can. And that simple, amazing idea is the secret behind this whole therapy.
So let's meet the star of the show, exosomes. The easiest way to think of them is like tiny little biological parcels, or messages, being sent from one cell to another. But these aren't just empty boxes. Oh no, they are jam-packed with powerful instructions, basically designed to kickstart your body's own renewal process.
So what's actually in these little parcels? Well, it's this incredible cocktail of biological information. We're talking about signaling proteins that act like messengers, growth factors that tell your cells to get busy, and even the genetic blueprints, like RNA, for repair. It's basically the entire instruction manual a cell needs to start rebuilding.
Okay, so what is the actual goal here? This is what's so cool about it. Unlike treatments that just, add volume or freeze muscles, this is about something totally different. The whole point is to get your own body to rebuild healthier, younger tissue from the inside out.
Let's break that down. On one side, you've got your traditional treatments, like fillers, which literally just fill a space, or Botox, which paralyzes a muscle. But on the other side, you have exosomes. They're not a temporary patch. They are a direct command for your own cells to wake up and get back to the business of renewing themselves.
And the results? They're pretty wide-ranging. For your skin, we're talking about better overall quality, fewer wrinkles, and a real increase in firmness. It also does a great job of evening out skin tone and calming down inflammation. Plus, and this is a big one, it can seriously speed up your recovery after other procedures and even get your hair follicles to start growing again.
All right, so we've covered the what and the why. Now let's get into the nuts and bolts of it. Let's talk about how this all works in practice, the procedure itself, and what kind of results you can actually expect to see.
So, for these little messengers to work their magic, they need a way to get into the deeper layers of your skin. The most common way to do this is with microneedling, which creates these tiny little channels for them to travel down. They can also be injected in a series of tiny shots. That's a technique called mesotherapy. Or even just applied right after a laser treatment to give your recovery a huge boost. There is a non-invasive option, but just know the effect isn't quite as strong.
And here's some good news. One of the big selling points here is convenience. The whole procedure is pretty quick, usually taking somewhere between 30 to 60 minutes, and the downtime, it's really minimal. Most people just have a little bit of mild redness for a day or two, which is super manageable.
Now, it's really important to remember this is all about long-term results, not some overnight fix. A typical game plan involves 1 to 3 sessions, usually spaced about 3 or 4 weeks apart. And because it's your own body doing the work, the results show up gradually, building over 1 to 3 months as your cells really get going.
Now, if you're familiar with regenerative treatments, your first thought is probably about PRP, right? Platelet-rich plasma. So how does this new exosome therapy really stack up against it? Let's put them head-to-head and break down the differences.
Okay, let's really look at this. First, the source. Exosomes are a ready-made, highly concentrated product made in a lab. PRP, on the other hand, comes from your own blood. Because of this, exosomes send much more powerful, consistent signals. Their effectiveness isn't tied to your age or your current health, which can sometimes be a limiting factor with PRP. The main trade-off, exosomes are definitely the more expensive option.
All right, before we wrap this up, there's some absolutely essential details that you need to know. This is the really practical, must-have information for anyone even thinking about this therapy. Okay, please pay close attention here. This next part is incredibly important. If you're seriously considering this treatment, there are a few key things about safety you absolutely need to have on your radar. So here's the #1 thing to get. Exosome products are not regulated like medicine. That means the quality can be all over the place, so it is absolutely crucial to make sure any product being used is certified and comes from a reputable source. And of course, it's not for everyone. It's generally not recommended if you're pregnant or if you have certain autoimmune or oncological conditions.
So who really stands to get the most out of this? Generally, it's a fantastic option for people around 35 and up who are starting to notice those first signs of aging. like skin that just looks a little thin or tired. It's also incredibly effective for treating things like post-acne scars, for speeding up recovery, and like we mentioned, for tackling certain types of hair loss.
So where does all of this leave us? We've seen how we can literally send targeted messages to ourselves, telling them to act younger. So maybe the future of rejuvenation isn't about adding something new from the outside, but about finally learning to speak our body's own language. It's a pretty fascinating thought, isn't it?